people in this video, let us look at this case study. Again, it's a child. A 10-year-old boy presented with sudden onset of periorbital edema, hematuria. See, hematuria. If hematuria is there and edema is there, what will it be? Nephritic syndrome and a history of sore throat. Sore throat means some streptococcal infection can be. Now, the blood pressure is 150 by 110. Smoky red urine. So, there is hematuria. There is blood in urine. Protein is more in the urine. Blood is in the urine. Urine. Okay, then there are RBC casts. Okay, there are RBC casts. So, look at this. RBC casts. RBCs in the blood. Blood in the urine. Smoky red urine. Hematuria. Other than that, what and all you are seeing? Edema. Protein in the urine. Periorbital edema. So, indicates something to do with the kidney, right? So, now, what is the diagnosis? Diagnosis is nephritic because here there is blood in the urine. 2 points to favor your diagnosis. Say this, edema is there, hematuria is there, protein is found in the urine, RBC is also there in the urine. What are urinary casts? How are they formed? Let's look at this now. So, this is the answer for the first question. Moving on to the urinary casts, how are they formed? Urinary casts, more details about them. See, deposits in urine can be cells, casts, crystals. Okay, all these three can be there. In cells, what and all you can have RBC, WBC, some epithelial cells, etc. Sperms also can be there in urine. Now, coming to casts, you will have hyaline casts, granular casts, fatty casts, waxy casts, broad casts. There can be cellular casts like RBC casts, red cell casts, white cell casts. In this case, what you are seeing, red cell casts, RBC casts, right? Other than that, what casts you can have? Fatty casts, which you have already seen in nephrotic syndrome. You have seen fatty casts, right? What exactly, then coming to crystals. Crystals you can have, these definitely some shape will be there, exact geometric shape will be there. That is when it will be called as a crystal. So you have like calcium oxalate crystals, uric acid crystals, ammonium urate crystals, cholesterol crystals, bilirubin crystals. So many crystals can be there. Now when it comes to casts, they are asking you what casts are and how they are formed. So these casts are cylindrical structures like this, okay. And what happens, they have taken the shape of the tubule itself. That's why they'll be cylindrical. So what happens, how are these casts actually formed? See, there is stasis, that is slowing, right? Then there is low pH, high salt concentration of the filtrate. So there is denaturation and precipitation of something called as tamm horsfall protein, okay. Then some hyaline casts. Then this cellular elements, they get entrapped in the hyaline matrix to form cellular casts. Some degeneration of cells within the cellular casts to form coarse granular casts. Then prolonged stay in the tubules will make these cells to form waxy casts. Then you get some broad casts. So basically, something like hyaline casts are first formed. All these are formed because of what? Casts are formed because of stasis, low pH, high salt concentration. That time what will happen? Some protein is there called tamm horsfall protein. This one, there will be denaturation and precipitation. There is denaturation and precipitation. Then hyaline casts are formed. Then this cellular casts, how they are formed? When cells get embedded in hyaline cast, that time it will become a cellular cast. If you want a granular cast, the degeneration of these cells within cellular cast becomes granular cast. Then further degeneration of the cells, okay, because prolonged stay, that will become waxy cast. How waxy cast is formed? Further degeneration and prolonged stay in the tubule will form waxy cast. Then they are saying it is nothing but broad cast. Okay. So you have cellular cast. Example, what are the cellular casts? RBC cast, WBC cast, etc. Where do you find these fatty casts? Fatty casts they didn't mention here, right? Fatty casts you will see in nephrotic syndrome. Here we are talking about nephritic syndrome. Okay. Meet you in the next video. Bye bye.